Hello, my name is Ryan Wannett, and I'm a respiratory therapist at Gaylord Specialty Healthcare. Taking a family member home who requires ventilator support is a huge commitment. Here at Gaylord, we want to provide you with some vital information about what it takes to prepare yourself, your family, and your home for a ventilator patient, so that you can make a thoughtful, informed decision about the care of your loved one. One critical consideration when thinking about bringing a patient home on a ventilator is what it takes to prepare your home. There are a variety of factors that must be addressed, including your home's electrical systems, layout, and sleeping arrangements. Once you've selected a home care company to provide your ventilator, the company will reach out to arrange a home inspection. Here are some of the things you'll need to address with them before bringing a vent patient home. Your home will need an electrical inspection to ensure that its power systems are safe and reliable enough for the operation of a ventilator. Ventilators need a constant power supply. You will also need to purchase and install an automatic backup generator for your home in case of electrical outages, if you don't have one already. You may even need to consider purchasing a backup ventilator in case your primary unit fails, if your home care company does not provide one. You will need to evaluate your home's accessibility. If your loved one has mobility issues, you may have to make alterations to your home, such as adding a wheelchair ramp in order to accommodate your loved one. There should be an area for the ventilator patient to sleep within view and earshot of the caregiver, something that might even require sharing a room with the patient at night, depending on your home's layout. Caregivers will also need to notify their electric company and local emergency medical services that a ventilator patient resides in the home. This will allow responders to be better prepared to assist you in the event of an emergency or natural disaster. Once you and your home care company have determined your home is safe for a ventilator patient, there are many other important factors to consider regarding the day-to-day care of your loved one. Bringing your loved one home on a ventilator is a 24-hour-a-day commitment. A patient on a ventilator cannot be left alone, not even while the caregiver takes a shower. This will limit your ability to run errands and to continue employment if the primary caregiver is currently employed. There must be at least one full-time caregiver and one backup caregiver. The backup caregiver should be a resource to allow the full-time caregiver breaks and take over if the full-time caregiver becomes ill or injured. The more caregivers you have, the less impact there will be on the primary full-time caregiver. At night, the caregiver must sleep within earshot of the ventilator so that they can hear and respond to the alarms as needed. No smoking can take place in the home. It poses a serious danger if oxygen is in use and is harmful to the already compromised respiratory system of your vent-dependent loved one. You'll also have to consider your loved one's level of portability. Many factors influence a patient's mobility status, including the resources in the home to aid with mobility, the comfort level of the caregivers, and whether the patient is on a ventilator full-time or only at night. Each of these variables will affect how much your loved one can move about your home and around your community. One crucial consideration is whether your loved one is on a ventilator only at night, known as nocturnal, or full-time. This may be determined at the acute care hospital prior to coming to Gaylord, or at Gaylord after we have attempted as much ventilator weaning as your family member can tolerate. Nocturnal means the patient comes off the vent for most of the daytime hours. Full-time vent support means the patient does not come off the ventilator at all. The mobility of a full-time vent patient will be much more limited. In either case, you'll need to understand the alarms on your loved one's ventilator. We will go over how to respond to each alarm and to troubleshoot how to clear alarms during training here at Gaylord and training with your home care company. It's important to understand the role of the home care providers in your loved one's daily care. Nursing staff is in the home only to provide nursing care and will not take care of the vent. Aides take care of the patient, not the vent. The home care company's respiratory therapists will provide support, answer questions, and be there when the patient is first discharged home. They will check on you after the first day home, but will not be in the home providing care. The primary caregiver will be the person operating the ventilator in the home upon discharge. It is difficult to hire a private respiratory therapist for ventilator care in the home. There is only one therapist that we know of in Connecticut that does this. Private aides and nurses associated with an agency will not provide vent care due to liability concerns. The caregiver hiring private staff for the home needs to ask about what the staff will and won't be able to do in the home for the care of the vent-dependent patient. For more information about home ventilator care, please refer to the other videos in this series. We hope this video will help you to make the very best decision for your loved one and your family.